A lot of questions about breast augmentation because it's still one of the most common procedures that I do and one of the most popular procedures out there. So when I see a patient for a breast consultation, it really involves a lot of talking about, what the patient wants, what are the patient factors, and what do I think would be ideal for that patient as a surgeon, just looking at it from an anatomical point of view. So the patients will often come in saying, uh, I want boobs, I want breast augmentation, I want to be this size or that size. And for me, it's important to really get a sense of where the patient wants to go, obviously. But then within that, I need to really break it down into what are the things that can get us there safely, really giving the patient the results that they want, but within the context of their anatomy. So as a surgeon, I'm looking at, tissue quality, asymmetry. What's the quality of the skin? Is there drooping of the breasts? Did they have pregnancies or not? Did they breastfeed or not? So those are all very important questions for me going into the consultation. And then, of course, the physical examination is key. So when I do a physical examination, I'm looking at, how tall the patient is, how much she weighs, um, the quality of the tissues. So you want to see is there a lot of loose skin? Are there stretch marks? How wide the patient's chest is, because that's going to determine the size or profile of the implant, and we can talk about that because that's a very important consideration for each patient. So the goal for me is to obviously enhance the breasts, but create a very natural look, create a look that fits the patient's body, and also create a look that's going to have longevity. Because if you put implants that just aren't right for that body frame, if you overstretch the skin or if you overstretch the pocket, then that patient's going to have issues down the road with implant malposition, bottoming out. So complications like that can be easily avoided by just picking the right implant for the right patient from the get-go.